Hello, this is #ArtfulAspie with an update of my PET scan and immunology. However, I wanted to show and begin with some photos of my skin close up to show the disruption from my radiation therapy.
Okay, I'm at the what is known as the borrow pits, which were a development where the earth was removed to build Ross River Dam, the Australia's largest earth bank dam, and it's created an artificial damp lowland which is being taken over by birds and other wildlife, and it's a protected area. It's a bit dry at the moment because we're in a very dry place. Now it's a fair walk from home, but I have my big hat, and it's early morning, so the intensity isn't there. Those photographs I showed at the beginning, I had to sort of put in as photographs because this camera doesn't really pick up the tone of my skin. It tends to show it as rather white and pink when it's really much redder than it appears. Now, last week, of course, I had my visit to the Immunology Centre. The results of my PET scan were in. It showed the disruption that the radiation therapy had done, so I've got the lethargy from that. I need to go through quite a bit of healing in this area, and it was quite clear on the PET scan. A more positive aspect was that the node in my lung may not at all be melanoma. It's just a node. You can have a node in your lung. It could be anything. I was a potter for years, so it could be calcium, it could be anything else. But the doctor is not worried about it because it hasn't changed in size, and that's good news. Now, what type of immunology will I be on? That will depend on the BRAF test. It's a genetic test done on a portion of the tumour removed at the time of the surgery. And because it is a pretty difficult sort of test to do, it's probably sent away. The tissue material will be cleaned, and then a genetic count will be done. This will show whether I have a mutation that tends to make melanoma grow. I have a suspicion that that might be the case. Now, if it is, it will sway the decision on the type of immunology I have. Do I have it by vein, or do I get tablets? Both, by the way, have horrible side effects. Hair loss, skin changes, problems with heart, liver, lungs. The worst, both will aggravate my psoriasis. Now, my psoriasis already is quite difficult. I have to put cream on my feet and knees and my scalp just to sort of get through a day. It's itchy, it's really quite unpleasant, so that's going to get aggravated. And then the thyroid is the next thing. It may get overdeveloped, so I'll get bloated, or go the other way and I'll have no energy. Now, I'm already feeling the lethargy and the tiredness from cancer treatment. So how the future goes will depend very much on that BRAF test, and I'll do an update there. I'm also going to do something with my art, and I will do a short about that because I'll need to do a fundraiser to have an exhibition down south. So that's where I am at the moment, and thank you for those who are watching this and keeping up to date with these updates. And yeah, okay, you know, I'm not the most cheerful person in the world, and I just have to accept what's happening. But you know, every time I go to that hospital and I meet another oncologist, I sort of feel like I'm getting shot somewhere. It's a slap to my face. It's just a realization that things are quite serious, and without this treatment now I've got to go into, what will I do in 5 years' time if I get melanoma again? It's not a great prospect. Okay, thank you for those who watch this and give me support. Bye.